Hi, my name is Gurkamal Chatta, and I'm the Chief of Genitourinary Oncology at Roswell Park. So, immunotherapy has been around for decades. So when we talk about immunotherapy today, it's really the newer treatments that we use for various different kinds of cancers to see how we can, harness the immune system or exploit it to treat our own cancers. In fact, the first immunotherapy that was approved for the treatment of cancer in general was in bladder cancer, and that is BCG, which has been used for decades for the treatment of early bladder cancer and is still probably the single most effective treatment for treating early bladder cancer. And more recently, in the last 10 to 15 years, we've started using immunotherapy for advanced bladder cancer and more recently for locally advanced bladder cancer. So I think one of the big problems in immunotherapy in any cancer is the fact that we have immune cells or T cells. They recognize the cancer, but they can't quite kill it. And that's because they are dumbed down or they have brakes on them and they just can't get activated. So with this new generation of drugs, which are called checkpoint inhibitors, they go ahead and remove brakes on these pre-existent T cells so that then these pre-existent T cells or immune cells can effectively kill the cancer. But I think the much more important thing here is, compared to chemotherapy, which is the other main treatment for bladder cancer, the side effects are less and are completely different. In fact, in the majority of people, they really don't feel anything at all. That said, probably the two commonest side effects of checkpoint inhibitors or immunotherapy for bladder cancer are skin rash, itching, and diarrhea. And that probably happens in about 10 to 15% of people. So I think there are several reasons why somebody should be coming to Roswell Park for immunotherapy. So first of all, Roswell Park has been dedicated to developing more effective neuroimmunotherapies for decades. Secondly, again, and we don't talk about this very often, immunotherapy is only effective in about 25 to 30% of patients. So I think one of the big areas of research here is how do we make these existing immunotherapies even more effective? And we have a number of clinical trials going on in that realm, where essentially what we are doing is we are taking existing immunotherapies, i.e. the checkpoint inhibitors, and combining them with other immune drugs to see if we can improve the batting average and impact an even higher number of patients.